Don't touch these 8 foods if you have diabetes or high blood pressure. Diabetes and high blood pressure, hypertension, are 2 of the most prevalent chronic conditions affecting millions of people worldwide. According to the World Health Organization, WHO, approximately 422 million people have diabetes, and an estimated 1.28 billion adults suffer from hypertension. These conditions are closely linked, as high blood sugar levels can damage blood vessels, increasing the risk of hypertension, while high blood pressure exacerbates diabetes complications. Diet plays a crucial role in managing both conditions. Certain foods can cause dangerous spikes in blood sugar levels, increase insulin resistance, and lead to fluid retention, worsening hypertension. Scientific research suggests that avoiding specific foods can significantly reduce the risk of heart disease, kidney failure, and stroke, all of which are complications of uncontrolled diabetes and high blood pressure. In this article, we will explore 8 foods that should be strictly avoided by individuals with diabetes or hypertension. Understanding the impact of these foods will help you make informed dietary choices for a healthier lifestyle. 1. Sugary beverages, sodas, energy drinks, and sweetened juices. Sugary drinks are among the worst offenders for both diabetes and hypertension. These beverages contain high amounts of refined sugar, which leads to rapid blood sugar spikes and increased insulin resistance. A study published in the journal Circulation found that people who consume sugary drinks regularly have a 26% higher risk of developing type 2 diabetes. Additionally, the high fructose content in sodas and energy drinks contributes to weight gain and visceral fat accumulation, which are risk factors for both conditions. These drinks also contribute to high blood pressure by increasing sodium retention and causing dehydration. 2. Processed meats, bacon, sausages, and deli meats. Processed meats contain excessive amounts of sodium and unhealthy fats, which can elevate blood pressure and cholesterol levels. A study in the American Journal of Clinical Nutrition reported that consuming processed meats increases the risk of cardiovascular diseases and hypertension due to their high sodium and preservative content. Furthermore, many processed meats contain nitrates and nitrites, which have been linked to insulin resistance and higher inflammation levels in people with diabetes. Reducing or eliminating these from your diet can help maintain stable blood pressure and blood sugar levels. 3. White bread, pasta, and refined grains. Refined carbohydrates, such as white bread, pasta, and white rice, have a high glycemic index, GI, meaning they cause a sharp rise in blood sugar levels. Research from the Harvard School of Public Health found that diets high in refined grains increase the risk of type 2 diabetes by 21%. For those with hypertension, these foods can lead to weight gain and increased insulin resistance, further complicating blood pressure control. Instead, opt for whole grains like quinoa, brown rice, or whole wheat bread, which have a lower glycemic impact and provide essential fiber for better glucose regulation. 4. Fried foods, French fries, fried chicken, and donuts. Fried foods are high in trans fats, which increase bad cholesterol, LDL, and lower good cholesterol, HDL. A study in the British Medical Journal, BMJ, found that frequent consumption of fried foods raises the risk of developing diabetes and heart disease by 25%. Additionally, fried foods contribute to hypertension by increasing arterial stiffness and promoting inflammation. The excessive salt content in fried items further elevates blood pressure, making them dangerous for individuals with hypertension. 5. Canned soups and packaged foods. Canned soups and pre-packaged foods may seem convenient, but they are loaded with hidden sodium and preservatives. The American Heart Association, AHA, recommends consuming no more than 2,300 milligrams of sodium per day, but just one serving of canned soup can contain over 1,500 milligrams of sodium, nearly two-thirds of the daily limit. Excessive sodium intake leads to fluid retention, causing the heart to work harder and increasing blood pressure. For people with diabetes, high sodium levels can also worsen kidney damage, a common complication of the disease. Instead, choose fresh, homemade soups with minimal salt and natural ingredients. 6. Sweet pastries and baked goods. Cookies, cakes, and pastries are packed with refined sugars, unhealthy fats, and white flour, making them extremely harmful for diabetics. These foods cause rapid blood sugar spikes, leading to increased insulin resistance over time. In addition, baked goods often contain partially hydrogenated oils, which increase the risk of artery clogging and high blood pressure. The American Diabetes Association, ADA, advises replacing these with natural sweeteners like fruit or opting for fiber-rich alternatives to keep blood sugar levels stable. 7. High-sodium condiments, soy sauce, ketchup, and salad dressings. Many condiments, including soy sauce, ketchup, barbecue sauce, and bottled salad dressings, are loaded with sodium and added sugars. A tablespoon of soy sauce alone can contain over 900 milligrams of sodium, nearly half of the recommended daily intake. For those with hypertension, high sodium levels lead to increased water retention, raising blood pressure and straining the heart. Individuals with diabetes should also be cautious, as hidden sugars in condiments can contribute to poor blood sugar control. Opt for low-sodium or homemade versions of these sauces to avoid excess salt and sugar intake. 8. Full-fat dairy products, cheese, whole milk, and cream. While dairy products provide essential nutrients, full-fat versions can be problematic for those with diabetes and high blood pressure. Full-fat dairy contains high amounts of saturated fats, which can contribute to insulin resistance and increase bad cholesterol levels, raising the risk of heart disease. A study in the Journal of Clinical Endocrinology and Metabolism found that excessive saturated fat intake correlates with increased inflammation and poor glucose metabolism. Those with hypertension should also avoid full-fat dairy, as it can contribute to arterial stiffness and weight gain. Instead, opt for low-fat or plant-based alternatives like almond or soy milk. If you have diabetes or high blood pressure, being mindful of your diet is crucial. Certain foods can worsen symptoms, increase health risks, and lead to severe complications like heart disease, kidney failure, and stroke. Avoiding sugary beverages, processed meats, refined carbs, fried foods, high-sodium items, and full-fat dairy can help regulate blood sugar and maintain healthy blood pressure levels. Instead, focus on a balanced diet rich in whole grains, lean proteins, healthy fats, and fresh fruits and vegetables. Small dietary changes can have a profound impact on long-term health, reducing the risks associated with diabetes and hypertension. Always consult with a healthcare professional or nutritionist before making major dietary adjustments. Medical disclaimer. This article is for informational purposes only and is not intended as medical advice. If you have diabetes or high blood pressure, consult with a qualified healthcare provider before making any changes to your diet or lifestyle.